Performing a peripheral lab draw utilizing the straight needle system and Vacutainer holder. Before beginning, confirm the physician's order for the lab draw. Gather the following supplies: an alcohol prep pad, 2x2 gauze, a tourniquet, tape, straight needle, also called an eclipse needle, for the lab draw, the Vacutainer holder, hospital-approved labels, and gloves. Consult the individual hospital policy in all cases before proceeding. Upon entering the room, perform hand hygiene, identify the patient using 2 forms of ID, turn on the overhead light, and place the bed to an appropriate height.
Good morning, sir. My name's John. I'm a registered nurse, and the doctor has ordered that we collect a blood sample to send to the lab this morning.
Explain to the patient the procedure, the reason for the lab test, and when the results can be expected. When choosing sites, first assess if the patient has a contraindication to venipuncture on one of the upper extremities. Such contraindications may include a history of mastectomy on the side of the upper extremity, surgical removal of lymph nodes of the upper extremity, presence of an AV fistula, presence of a PICC line, or other conditions making use of a particular arm inappropriate for venipuncture. Consult your individual hospital policy on precautions and contraindications for venipuncture. Don gloves, open the dressing and place within reach. Prepare a piece of tape. Twist off the straight or eclipse needle cap and attach a clear Vacutainer holder. On the selected arm, apply the tourniquet approximately 4 inches above the location being assessed for an appropriate vein. It is important to remember that the tourniquet should not remain in place for greater than 1 minute. Clean the site for 30 seconds with an alcohol prep pad. Allow to air dry. Do not blow on the site or fan the site. Carefully remove the cover over the needle and discard. Stabilize the vein, taking care not to contaminate the clean site. Prepare the client for the stick and insert the needle at a 15 to 30 degree angle, depending on the location of the vein. Flatten out the needle and advance. Push Vacutainer lab tubes into the clear Vacutainer holder and allow to fill. Fill the tubes in the correct order of draw, inverting the tube if necessary after obtaining. Remove the tourniquet. Place a 2x2 dressing over the insertion site. Remove the needle and activate the safety device. Do not recap the needle. Apply pressure to the 2x2 dressing at the site. Discard the sharp in the sharps container. If needed, place tape over the bandage at the site after hemostasis has occurred. Label the tubing at the bedside, ensuring that proper date, time, and initials are present. Confirm again with 2 forms of patient identification and place the tubes in the biohazard bag. Prior to leaving the room, provide for patient safety by rechecking that the tourniquet is off, the bed is in a low position, and the call bell is in reach. Also, confirm that there is no bleeding at the puncture site. Transport the sample to the lab.